There's a lot of things people take for granted the clothes on your body, the roof over your head, and the food on the table. But out of all those things, it's impossible to live without food. Even though that's the case, around 47 million people in the US are food insecure, and of that, at least 39.4 million Americans live in places where getting access to healthy food is hard. Those areas of low access are called food deserts. Food deserts most prominently impact communities with lower income and high poverty. A majority of those people end up being minorities or people of color. Food deserts exist in those areas for a multitude of reasons, which include distance, or how far you are from a supermarket or grocery store, being financially unavailable to buy healthy foods, the environment which hinders the ability to access foods, supermarket redlining, which is when supermarkets are hesitant to open up in neighborhoods they deem risky, and residential segregation, when different residential areas have an uneven distribution of populations because of certain zoning laws. Supermarket redlining and residential segregation are underlying results of structural racism, which are policies and laws that maintain racism in communities. While a state itself may or may not heavily be impacted by food deserts, this issue is mainly a local problem that affects certain communities or regions. Even though this is the case, certain states can have multiple reasons facing this threat. So today, we'll be focusing on two cities with one of the highest food desert rates: Memphis, Tennessee, our urban city, and Bethel, Alaska, our rural one. Let's analyze these urban and rural food deserts and their solutions to change them so they can better address the problem within each respective city. Memphis, Tennessee. Immediately, Memphis doesn't look like a food desert. This city is within the diverse county of Shelby, composed of many suburbs, towns, and cities. But if you look closer, you'll start to see reasons where food deserts are present. Shelby County has 115,980 residents classified as food insecure, and 12.4% who lack access to healthy food for all household members. Food deserts are located in low-income and historically marginalized places such as South Memphis, Orange Mound, North Memphis, Whitehaven, and Fraser. Black people and Latinx people are most likely to live in communities without grocery store access. This is proven by the 62% of Black people living in Memphis, especially in segregated areas away from suburbs. This also leads to minorities having a higher chance to face health problems because of the low access to healthy food. The main reason Memphis is in this crisis is the fact that many grocery stores and supermarkets prefer to locate themselves in the much wealthier suburbs, as mentioned earlier, in a process called supermarket redlining. Along with the fact that insurance companies were hesitant to provide coverage to businesses in Black or minority neighborhoods, and that getting loans in inner cities is hard, supermarkets chose the safer option of opening up in suburbs. The city of Memphis and many food access organizations have attempted to address this issue. Things such as having farmers markets and food banks, and having access to programs such as SNAP, the Emergency Food Assistance Program, and WIC has significantly helped distribute food to food desert residents. Supporting these programs and local markets can help, but these are just partial solutions. While farmers markets can help supply healthy food, and food banks can make sure low-income individuals are able to access it, it's just a temporary fix to an ongoing issue in Memphis. But there still are permanent solutions available. A case study done by Ryan James from the University of Memphis explains how the city was able to replace two Krogers, a major supermarket chain, which closed in both low-income food desert areas. The Economic Development Growth Engine, EDGE, a local agency, was able to lower the risk of opening for both new grocery stores. For one, the agency gave a loan, and for the other, they researched profitability. Even though the solution didn't completely solve the problem of food deserts within Memphis, it helped give a new way to work out this issue. If programs such as EDGE continue to coordinate the support of current and the creation of new grocery stores or supermarkets, low-income areas within Memphis will be able to access healthy foods. To accomplish this, EDGE should work with community members to collect data and plan out the best areas to open up these stores. They should also find local grocery stores to support and sustain. Alongside opening new grocery stores, the city of Memphis should consider its outdated racist policies and zoning laws still affecting the black community, and supermarket redlining practices that hinder the creation of new stores. Both of these factors lead to racial segregation that, in the end, lead to food deserts. By updating zoning laws and removing policies that are against minorities, we can help desegregate Memphis to try to level the development. Implementing antitrust laws can help restrict major grocery store companies from preventing the opening of new grocery stores and creating empty property. These laws can promise competition which benefits consumers. While some solutions for urban food deserts can also be implemented into rural areas, if we look into Alaska, we can also have a different approach to address this side of the problem. Alaska, the state with the highest share of land area that is considered a food desert. Bethel, Alaska, has the highest rate of poverty within the state and is one of the major food desert areas. Alaska natives living there are the most affected by food deserts for financial reasons and because of proximity to the closest market selling healthy foods. 26% of all tribal area populations were around one supermarket. The dismantlement of native food systems by the government, along with the environmental barriers to receive healthy foods, has led to food deserts throughout Bethel and other Alaskan cities, and also caused many health problems. A case study from the Journal of Agriculture, Food Systems, and Community Development takes a note of multiple solution attempts and current solutions being implemented within regions of Bethel. One attempt at a solution was the Federal Distribution Program in Reserves. The program ended up serving low-nutrient foods that weren't culturally appropriate for Alaskan natives. But another solution looked at in the case study might help. There have been many programs started to help local organizations so meeting cultural and environmental needs are possible, along with being able to support local food sources. By implementing a federally funded program called the Produce Prescription Project or PPR, they can help natives get fresh fruits and vegetables from local areas that are appropriate for the use of traditional recipes. The programs can make sure people with health problems are able to get healthy foods and that families are able to be sustained. But these type of programs lead to a dependency and doesn't fully solve the problem of food deserts. While opening up stores can help, there is a better model to support tribal rural areas, a food sovereignty model. If the government gives food processing and distributing control to tribal communities, then they will be able to sustain themselves. These regions won't have to worry about the expensive food coming from other states and be able to make food that supports their own culture. Distance and spoiling wouldn't be problems with the fact that all their food is locally processed. By giving power to local communities and supporting the use of subsistence foods, food deserts within not just Bethel, but possibly all of Alaska can be eradicated for good. On paper, these solutions won't be able to help anyone, but how can these ideas be implemented? It's up to the local communities of Memphis and Bethel to advocate for themselves. The people who can make change, you council members and programs, should start planning and getting with local residents and natives to solve this issue. But to truly be able to do these solutions, especially food sovereignty, they'll need the help of national organizations like you, USDA, help support local communities and states while also making them able to sustain themselves. If everyone works together on this as a community, food deserts in these areas and everywhere else can be fixed. For further information, here are the websites, journals, and case studies used to research this issue. Work to make food a second thought for everyone.